Hi, this is Dr. Roy Kim with an update on a conference I just went to, APS Korea. Just in case you don't know, APS Korea is Aesthetic Plastic Surgery Korea, which is Korea's largest cosmetic surgery and aesthetic plastic surgery conference. It's always held in the spring, so I was honored to be a speaker there as well as be able to attend, where I learned a lot of stuff. Facelift was a huge emphasis. Dr. Nayak was the keynote speaker, and I did give a talk on what actually works after a facelift to help you with healing. So I'll talk about that more in another video. But essentially, a lot of the stuff that patients are now being recommended to get don't help or don't help that much. So I emphasize the things that actually help, and a lot of it is hype. At the conference, I also learned a lot about Motiva breast implants because Korea has an advantage. They've been using Motiva breast implants for a longer period of time than the US. So in the US, they've been out for about 1.5 years, whereas in Korea, they've had them for years. So one of my friends, Dr. Choi, has Korea's largest sample database of Motiva breast implant patients. So I talked to him, and a lot of the data that was presented was very interesting and overall good for Motiva breast implants. One of the hottest trends is ECM, extracellular matrix. So this is a product made out of cadaveric human fat, yes, cadaver, and it's really micronized or highly chopped up acellular dermal matrix or fat byproduct. We actually have ADM, acellular dermal matrix, available for several years in sheets. So we use it predominantly in breast surgery, a lot of it for breast recon. We can also use it in cosmetic breast. We actually also have fat products, if you will, that come in a syringe. One is called Renuva, and another one's called Alloclay. We can actually fill in defects into your face, into your breast or body areas for various reasons so that we don't actually have to harvest your own fat. We can actually process fat from an outside source and just get it delivered to our offices in syringes. Korea's done one better, where they actually chop it up so fine that when you get the syringe, you can barely see it. It looks like powder. They actually reconstitute it, add some liquid, and then use it as a skin booster for your face. Skin boosters, just in case you don't know, are sort of like vitamins for your face. It's like a facial times 1,000. One treatment session where you get a lot of injections in your face. I mean, your face looks good and is moisturized for months at a time. They can also use acellular dermal matrix, ECM, or similar products as a filler. ECM really in Korea is much more of a skin booster. It doesn't really add volume. They do have options where it can actually give you volume, which is what we in America think of as filler. Another interesting technology trend is HIFU, high intensity focused ultrasound. In the US, we really only have one product, Alltherapy, which is now a pretty old product at this point. It's been out for about 8 years or longer, and we don't have a newer one. Korea does have newer ones where high intensity focused ultrasound. You apply it to the skin. It really is meant to hit the SMAS layer where it can tighten things up and improve it. And it really works better because they have better technology, better lines, more specific heat levels generated at the SMAS level. They are working at getting FDA approval on this product, and hopefully it'll come to the US soon because I do think it's better. Finally, of course, I got to see some old friends, make some new friends, and I made a fun TikTok with my friends Caroline Kim and Charles Lee. So I hope you enjoy. The next APS Korea will be held sometime in the spring of 2027. I hope to see you there. And in the meantime, you can check out this other video where I talk about other technological and aesthetic advances in plastic surgery. Thanks so much for watching.